Good afternoon, everyone. My name is Bertrand Evans Taylor, and I am the founder and principal consultant at Ujima Cultural Solutions, a community engagement specialist and a longtime event producer. Ujima Cultural Solutions boosts organizational vitality by aligning the needs of arts leaders with the needs of their communities, and today we're doing just that. Just a few years ago, our world was shaken by the impact of the new infectious disease, COVID-19, especially as event planners. We were forced to change our operations and develop new ways of being. Now, 4 years after the first early case, much of the world has taken a back to normal approach. But as event planners, we can't afford to be that reckless. During our events, we are stewards of the safety of our attendees, and people often look to us for answers on the best way forward. However, things have changed. Our understanding of COVID-19 has grown, and we have a better mastery of how to mitigate viral transmission at our gatherings. People want to get together and want to be face to face. However, there is genuine risk to doing so, especially for the high-risk populations for whom COVID is an even greater risk. Therefore, if we want our events to be as inclusive and as accessible as possible, we have to understand how to manage that risk and ensure that all who are being invited belong. So I've gathered these two experts for this panel so that we can discuss what we've learned over the past few years of managing COVID at events and how mitigation looks in practice. On the public health side of the house, I've invited Amelia Hayward. She's currently a contractor at the federal government working as a scientific program analyst with the National Institute of Diabetes, Digestive, and Kidney Diseases, a component institute of the National Institute of Health. She also holds a master's in public health. And to speak from the perspective of an event professional, we have Matthew Che Kowal. Matthew, co-founder of Majestic Collaborations, Majestic Amplifications, and Majestic Water, is the festival coordinator, artistic director, spokesperson, musician, and community leader. His consulting with the performing arts readiness spans agencies, festivals, and venues in emergency and disaster preparedness. Contracted by Denver Arts and Venues, the Canadian government, brands like New Belgium, and festivals like Tour de Fat and Five Points Jazz Festival, he has organized hundreds of gatherings since 2005, collectively raising over $5 million to raise awareness and resources to capitalize locally directed initiatives and inspire advocacy. A passionate skill sharer, Matthew has used collective leadership to arrive at state-of-the-art festivals that are sustainable, safe, and equitable. A recovering marketer with a knack for initiating and identifying trends, he envisioned the experiential learning platform Art of Mass Gathering Symposium as a way to catalyze emergency preparedness training across multiple stakeholders. I'm excited about today's event and what we will all learn from each other. If you need any technical assistance, please message me using the chat feature. There will be a Q&A portion at the end of the discussion, so if any questions come up for you, use the Q&A button to ask them, and I will either incorporate them into the discussion or ask at the end. Now, I want to have a short moment of silence for the folks who have actually died from COVID-19. Thank you. We will begin with some information sharing from our experts to give us a baseline of knowledge before we get into the conversation. First, we'll hear from Amelia, and then Matthew will share. Thank you again for joining us, Amelia.
My name is Amelia Hayward. I do hold a Master of Public Health, and I am currently working with the National Institutes of Health. And I have a couple of years of experience also working on international COVID studies as well. The knowledge base that I kind of want to come to share with you all about COVID really just kind of starts out, I'll just give you basically kind of a baseline of understanding of really just what the virus is. So to start out, if anyone remembers, about 2002, 2003, we had what was known as a SARS outbreak. For anyone who might have been around or alive during that time, I was of a fair age at that time. But for those who may have been a little bit older or are a little bit older, you may have remembered we called it the SARS outbreak. And essentially, this outbreak was a respiratory illness that we saw. It started in China and it made its way kind of across the world, moving from China into the West. In doing that, we kind of learned what the first iteration of SARS is. And so SARS actually is an acronym that stands for Severe Acute Respiratory Syndrome. And so that speaks to the nature of what the SARS virus does. And so at the time, you were seeing cases, they were severe respiratory illnesses. So coughing, lung infections of the sort. The reason that I bring this up is because that SARS virus that we first were exposed to as a population in 2002, 2003 is essentially the cousin of the SARS-CoV-2 virus that emerged in where we think emerged in China in 2019. There is some evidence to suggest that there were cases of this virus, the virus that causes COVID-19, having emerged in other parts of the world in earlier 2019 and not necessarily also just in China, but around the same time. And so that's new kind of evolving information that we have been realizing just more so as the pandemic has progressed. Yeah, so essentially we all know SARS-CoV-2, the virus that causes coronavirus disease or COVID-19, it is a respiratory illness, but we see that though it primarily travels through airborne transmission, it presents as a respiratory illness, but it actually is a more systemic illness, meaning that it can affect more places in the body than just the lungs. If you've been kind of tuned into how news of the coronavirus pandemic has changed and evolved throughout the pandemic, you'll probably have seen that there have been links to cardiovascular issues, maybe some neurocognitive issues with brain fog, and probably lesser known issues of just with different organ systems of the body. So also the kidneys, the liver, and also notably the immune system. Knowing that and knowing that it is a systemic virus, a huge misconception that a lot of people I think have is that COVID-19 can be like a cold or can be like a flu. And that's not at all what the case is at all. For one, the flu is caused by the influenza virus. So that is a completely different virus from the coronavirus, which is the broad overall virus that actually constitutes what SARS-CoV-2 is. And it's not a cold because we know that colds don't cause blood clots. One of the things that SARS-CoV-2 does really, really well is that it induces the body to cause your bloodstream to clot up. And so that cardiovascular nature is what overall contributes to it being a systemic disease. Essentially, for you all as event planners, the thing to really, truly understand is that this is not some trivial cold that someone can get. There can be very long-lasting and damaging effects on the body. And that is obviously something that we need to be able to mitigate both as public health practitioners and as event planners, because as we all know, we as humans, we're a social species. We thrive on innate connection with each other. We wouldn't have gotten this far as a species without it, obviously. Being able to mitigate a disease that is a communicable disease that spreads from person to person is going to be essential, I say. And I think in terms of us being able to safely gather and do the things that make us feel human and make us feel like ourselves. And we'll obviously get into just different ways that it can be mitigated, because there are absolutely ways that transmission of this virus can be mitigated. It just takes some creativity and collaboration, but wanting you all to understand that it is a very serious virus. It's not something that can be taken lightly, something that we hopefully will be able to begin mitigating more sustainably and more equitably and more effectively than we have in the current time. I think that's about what I would like to say about it.
Thank you so much, Amelia. In the chat, we have someone who also thanks you for your overview of the systemic effects of SARS-CoV-2. And so next, we'll have some information sharing from Matthew, who will also have some slides to share. Thank you, Matthew.
Of course. Thanks for having me here. Thanks for the Performing Arts Readiness Organization for hosting this event, and then the events that they've done throughout COVID. There's been several hundred people tuned in for webinars about preparing for reopening and modifications and virtual events. I've hosted maybe 5 online learning events with Performing Arts Readiness. And there's a lot of other learning that you can do by going on their website. It's all free, provided by a grant from the Mellon Foundation. I see Steve Eberhardt is on our call. He's one of the great folks over there. Bertrand asked me to talk about the Art of Mass Gatherings approach. He said that we use a holistic approach to think about emergency preparedness, and I'll kind of lean into that. And if you'll indulge me, I'll go ahead and do a presentation about what that approach is and how COVID preparedness works into that. Some of this is going to feel a little bit retro and in the moment. I decided to leave some of the slides in that were earlier on in the COVID presentations that we did. And I'm going to add some new information as well. But I think the opportunity here is to consider pathogens in general and what preparedness as an event producer looks like. Bertrand already gave me a great bio, found something super complete somewhere. I'm really glad you said all that. Thank you, sir. Here's the organizations that we've worked with, Coalition for Arts Preparedness and Emergency Response, and CAPER, Performing Arts Readiness. We help contribute to this safe and sound reopening checklist that the Event Safety Alliance and the NEVA organization did. I'll point you towards this, I think, for a good refresher on a lot of this stuff. You can take a course. It's $10 at the Event Safety Alliance, the Pathogen Prepared Professional. It gives you a certificate that you can add to your LinkedIn and so on. And they really wanted to make it a broader concept, I suppose, of pathogens of all types so that it stayed a bit more evergreen. And I think they had a good approach there, a lot of videos. They also offer things like the Severe Weather Summit and event and access training. There's newer OSHA trainings, like 10-hour certificate for the event industry that I think is a good companion piece to all of this. During the COVID lockdown, I helped produce the 5 Points Jazz Virtual Festival. I think we had over 100,000 people tune in for that. We partnered with PBS. We were nominated for an Emmy for this, and it was a really great collaborative effort. And one of the cool things about it, I think, is that 5 Points in Denver is one of these really historically important and currently important neighborhoods. And all of the stuff that had been accumulated through years of documentary footage, when the opportunity came to do it as a virtual event, I think it gave a really broad perspective of what that neighborhood's about. You know, I produce a lot of special events, have produced over 100, and I love 5 Points Jazz Festival and was sad that it wasn't able to happen that year. But there's some sort of lemonade that got made by doing a virtual event to be able to look at a real broad view. Speaking of broad views, here's how we approach these things with the Art of Mass Gatherings that Bertrand and I and Jenny and Jessica and Tom and Steve have all, this is a bit of a potluck. I'm very thankful for everybody's input on how this has come together. But here's what we say we're going to try to balance when we are thinking about our event design. It's safety, sustainability, accessibility, and community engagement together that help you balance your resources as you make your planning. And this was based on the Salt, Fat, Acid, Heat cookbook that I loved. Anybody else who loves cooking, Nusrat Samin, she's a brilliant chef, and she was helping us through this book think of how you can develop your chops as somebody who makes decisions in the kitchen. I really thought that this was a good way to think of how you make decisions as an event producer, and that these elements here are what you're kind of running through your mind. Have I prepared for all of these sort of things in my planning? And have I used community engagement as a force magnifier to help make that all work? The bigger picture, even than that, I suppose, is that folks that are producing these large festivals and events, or whatever sort of mass gathering, there's some overlaps of knowledge that exists there. Whether it's a protest, disaster response, a giant festival, a lot of the wastewater power systems that are getting used, a lot of the community organizing techniques that are getting used. There's some cross fluencies here that we want to really try to develop. And we want to see people who work for cities and work in community arts and people who work in accessible design all have a chance to share in these practicing that we use festivals as classrooms to build these skills and build these networks. And thanks to Performing Arts Readiness, we've done this in a lot of places around the country. We use the existing luminaries who are in those communities to teach classes on their expertise. And COVID came in the middle of this. And so a lot of what I'm going to share today is about how we made a plan for Art of Mass Gatherings at festivals, how we adapted our plans and our trainings through COVID, and what sort of has come out of that for larger preparedness efforts. You might use COVID as a practice to say, as bad as it was, there's still some things that can be learned for other sorts of disruptions. We had a lot of public health people participate in our Boston event, and that was a real exciting place to see how public health professionals are very excited about these festivals as a place to do community outreach for public health. And Amelia, a lot of kind of colleagues of hers would have been folks that we were excited to have from the public health side. These are the places we've done art at mass gatherings so far. I think the Puerto Rico one would be one that I'll bring up in the future of this talk as a resiliency hub model that is an important place to think about universal design. And we were featured in FEMA's experiential handbook for mitigation and resilience. So I'll get right into the safety part of this, the specific COVID stuff. Public health, experiential learning is a big part of what we've done. This was around harm reduction. You're seeing some pictures here, but prior to this, a lot of it had to do with COVID preparedness. The disease mitigation design was a priority of the safety classes that we made during COVID, but they're next to mental and physical first aid, crowd management, harm reduction, anti-violence, all of this. We did trainings on these things together. If you look at the Event Safety Alliance, your COVID plan would be part of your overall risk assessment and your safety incident management plan. You're balancing your resources for all of these things against what are the most likely ways that people are going to get hurt at your event. It could be COVID, it could be a weather emergency, medical emergency, there's active harm or preparedness. So your COVID plan is part of your whole safety plan. And then your worker safety, a lot of this has to do with working with AHJs. That's authorities having jurisdiction. Do you have an overall safety plan for your event? If you don't, or for your venue, I would definitely point you towards the performing arts readiness classes. There's still grants available for doing safety planning that are closing early next year. So if your organization wants to get some support in making your overall safety plan, I'd point you there. And COVID preparedness could be a part of that plan. A couple things Bertrand talked about, the equity of how these safety planning or COVID planning can go in general. And I think one of the things that came up during COVID that was interesting, I think, was this moment. This was a Spanish theater. The picture on the left are the seats down on the floor, the more expensive seats. Seats up top were way more dense. And there was almost a riot at this theater. People were torqued off. They felt like the cheap seats got pushed into a lot of density that the more expensive seats didn't. And I think that this is probably a good place to think about how our equity of our rollout of COVID response could go wrong. There's a lot of creativity came up. Here's a lot of opportunities to do video. They played for a bunch of plants, and then those plants were donated. Here's some of the response that we worked out in Denver. This was a Black Lives Matter concert on the left there. We used battery-powered systems to do a very diffuse concert and protest. Here's a battery system that allows you to do satellite systems. People had been doing this a bit in the past, but time delay speakers allow you to give good sound coverage over a broader footprint. It allows people to be more spread out. It's something that people got a lot better at. And it's a lot easier to do now than it used to be. That speaker there has some programming in there where you just adjust how many feet away from the stage it is. Then it will make it time aligned so that everybody's hearing phase coherent sound. It's a little techie, but basically means your speakers can get pushed out bass wise, and then people don't have to be so crowded up by the stage to hear it well. Probably be good for 100 people or 200 people, and it's maybe $800, and the batteries are $200 or $300, so $10 a person. And then you get to use it again in the future. So, or you get your sound company to provide these things for a bit more money on the rental. I think that a lot of these things would be something you'd have your sound company do for your festival. But if you're an organization that's looking to buy these assets, that's the cost for that. Those two units would be about $1,000 for a speaker plus a battery. And then you'd already have your other sound system up front. Here's a picture during COVID of some sanitizers that were used on hi-hat stands. I just thought this was a pretty creative use. Here's probably one of the bigger picture things for any sort of pathogen preparedness that should be in your mind. Of all the things that you do to try to reduce disease spread, they get less effective towards the bottom of this pyramid. They might also get less fun, but if you eliminate the event, have very little disease spread. If you do substitution, that's more effective. All the way down to, PPE being some of the least effective ways to do the mitigation of disease spread, the Swiss cheese. And you want to talk about what that concept means, Amelia?
But yeah, so essentially the whole idea of the Swiss cheese model is obviously Swiss cheese has holes in it. The more layers you have of protection altogether equal the block of cheese. Yes, there may be respiratory illness transmission because no one mitigation measure is perfect, but taken together, the more of them that you layer onto each other, the more effective it is at actually preventing transmission.
If we find it, we'll throw it in there.
Yeah,
Imagine a
we'll
bunch of
throw it in there.
stacked slices of cheese.
Yeah.
Each thing you do is a slice. You said it well. And then I think what it's trying to help us do is to not rely on one thing to solve everything. It's the layered effect that kind of over time gives us good results. I put this in here as a way, this is probably something from Amelia's world. What's a good looking handout on how to share information? This is a good one. It has pictures. It's not relying too much on just text. This is the sort of stuff that we like to see in people's emergency plans for their organizations. This is a class that we offer through the Folk Alliance organization. If you go to this and want to get a weekly email that help do Art of Mass Gatherings or this 4 pillars approach, it does include some good resources for COVID preparedness or pathogen preparedness. And we're pretty proud of that. Thanks for the help from Performing Arts Readiness to do that. I'll go briefly through some of the other 4 pillars and look at places that it intersects with this COVID preparedness or any pathogen preparedness that we're still, active in. We've learned from our friends with Everyone's Invited that if everyone's on the access team and your performing arts organization, that's going to lead towards success. Transparency about accessibility, I think, plays into this pretty well too, that if people are coming to your event, they understand what precautions you're taking and what you're not taking. This is not a good time to do window dressing. This is not a good time to try to say we're the most accessible event ever if you're not. That way people can have informed consent about what they're getting into. And that's a good way to make sure that nobody has any surprises. Thanks to Laura Grunfeld. If you're looking for a good accessibility coordinator for your events, she's a great one. When we study festivals, we look at the accessible accommodations that they're making or not. This is part of our work with mass gatherings. Here's some of the improvised stuff we figured out for doing kits that we would mail to people. A lot of the performers with the 5 Points Jazz Festival were homebound, or they decided they didn't want to be exposed with their bands. And so we would mail them kits to be able to do home recording, and we would work with them on some of the technology to make a good recording that could get into this documentary. And I think it was a good equity plan to make sure that people got a kit that they could use to make their own recordings. That's Miss Diane Reeves there. Designing virtual events that are inclusive is important. Here's an ebook that we made with Folk Alliance. Jenny Filippetti led this effort. This was a good outcome, I think, of COVID was, first of all, we all got onto Zoom, but then we really started getting more elegant, I hope, over time with who is not being served by the basic level of online. The transcription's gotten so much better, the closed captioning, but that doesn't work for everybody. Often getting an actual translator adds a lot for people who are needing translation. And some of the supports, I think we went a long ways these last couple of years in seeing at least what could be done. We were talking, Amelia and Bertrand and I, the other day about dynamic adjacencies. One of the ones that you'll see at places now are breastfeeding and a sensory area in a stadium, in a venue. And so it's kind of interesting there, right? We're saying, all right, we have people with sensory needs and breastfeeding, let's make a room where those people can get what they need. And I think that as we look at COVID design or pathogen design, I really think there's opportunities for venues to think of how people can have other concerns, can get into venues in a way that's more accommodating. And when I look at this map, I think that this shows some of the ways that venues can look for different densities, and people can kind of navigate those densities a little bit more intelligently. If they go into a venue, they can see where it's going to be dense or not. That's a way that they can maybe participate. Here's some of the accessibility leaders in our country. The Kennedy Center's lead organization does a gathering that's really wonderful. And I know that COVID and all pathogen preparedness stuff is a really big part of how they look to increase accessibility at events, is being intelligent about how you design and share that. So these are some of the kind of main parts: is the waste systems, the water and food service, what kind of transportation people are using to get there, and then what's the plan to maintain sustainability goals in less than ideal conditions, disease mitigation efforts, but like what was the waste that was created by doing that? And so just looking at both, not to say you shouldn't use the mitigation methods, but with the 4 pillars approach, you're kind of balancing them all. And I guess I'll just throw back that consideration here too, of like in your whole safety plan, there's a lot of things to consider, whether it's COVID, weather emergencies, medical emergencies, all of these things are sort of on the table at the same time. And so deploying resources in a way when they're limited, which is kind of how we all are in arts and cultural spaces, is there's only so much time and money to go around. giving yourself some time to think about that and engage with stakeholders to get a feedback before you deploy all your resources is the best way to do that. The overlap here with sustainability, I would say, is with COVID, food preparation is a pretty big one. We were talking about this, Amelia and Bertrand and I, that the pathogens that can go through food preparation is definitely a place to look for improvements. And then with mass gatherings, we look for ways that people can practice for doing large food operations for disasters at festivals and provide food that's more culturally sensitive. The organization that Chef Andres does has been doing some really cool work with that. And I think that overlaying pathogen preparedness with food preparation is a pretty smart thing for your organization to do. We definitely learned some things during COVID about how much waste was created by all of the masks and all of that stuff. And this organization has some toolkits for doing greener ways to both balance safety with thinking about ways that are lower waste. That was an interesting intersection. And then Bertrand is our community engagement professional. So I'll leave all the meat on the bone for you about that. One thing we learned through COVID was a lot of outdoor design. Tactical urbanism, if you haven't heard of it, is about using opportunities to make small demonstration projects to learn from before you spend a lot of money on infrastructure. And boy, did we learn a lot during COVID about how to do different sorts of public space modifications. And we're still going to be learning a lot more too about what was the smart ways to have done that. Should we have invested more of that money into upgrading the ventilation system and filtration, or making all of these outdoor tents that seem to me to have pretty bad ventilation? There's a lot of ways that we tried experiments there to still be learning from. The Cosmopolitan Canopy is a wonderful book, I think, when you're trying to zoom out a little bit on this whole process of making community involved events. Elijah Anderson wrote about making spaces that self-police and self-regulate. And so you need less interventions from law enforcement and things like that. And I think that this is also about how people can norm and do more sort of social contracts where they take care of each other well. And that to me is what this art of mass gatherings work with all the other luminaries is leaning towards, is like, how do we design spaces where there aren't victims and that there's more transparency of who can participate with better equity. I'll just throw out one interesting intersection our friend Jessica brings up often. You can make some sort of unintended consequences when you get real strong about one of the pillars and you don't think about the others. For instance, when they said no plastic straws, we're not going to have any at our event because they're not green. That can impact people who need to use straws for nutrition because they have that accessibility need. And so that's why we sort of encourage thinking about all four pillars is, if I make a big improvement or rule in one of the pillars, what are the consequences that might roll out of that particular effort? So those are the big picture things I'm glad to have shared. Thanks for the invitation, Bertrand and Amelia.
Thank you so much, Matt. That was definitely very informative. What both of you shared definitely sets the tone. While I've been planning this entire thing, one thing that's really been on my mind, the privilege that we have as event planners, how we can use that to make our events better, but also make them safer and more inclusive. So for me, it's key that we understand that privilege and take an inclusive perspective on how we're managing spaces and the people within them. Well, to you all, what are the key considerations for responsible power and privilege sharing among event planners, especially when managing COVID-19 related risks? I'll ask Amelia first.
I think the first thing is knowing that you have the power in order to, help lessen and try to mitigate transmission, especially if we're specifically talking about COVID-19. Like I've said before, obviously, whenever there are people in a space together, especially in the current context that we live in, there is the chance for transmission of this virus just because of the fact that it is an airborne virus. We all share the same air. So whenever inevitably you're coming and having people gathering together and you're planning these events, that is honestly feels like one of the first things you probably have to think of in this current context if you want to be a responsible event planner. I don't think it's to anyone's benefit that this consideration is ignored, because it is, as we've seen and will continue to see, especially as we're going into this holiday season and everyone's going to be gathering, it's going to remain ever more salient, I think, for us. If you are a steward of a space where people are coming together and having people come together for a purpose, I think that is something that you have to take into consideration. Being able to arm yourself with the best information possible and the most up-to-date information possible about how to prevent these kinds of things in terms of event safety. Because in general, you are looking at this from an event safety perspective, and that's safety from as many threats as possible, if you think about it. The biggest thing is being able to employ the best strategies that you can. Because also, and I'm sure we'll have more of a conversation about this, but being able to gauge kind of what the group that you are catering to is comfortable with and what they might be willing to do with these kinds of events is also key as well. I think as event planners, it does in a way behoove you to really take this fully into consideration in the current context in which we live.
I guess the part I would share, Bert, it would be, I can only kind of speak to some of the things that I know probably most intimately or whatever would be around artist relations, that there's a power dynamic between the venue and then whoever's on the stage that probably is one of the most interesting power dynamics, right? And so often those artists need the money. They're not necessarily getting paid so good. They need to be there. And so that power dynamic is probably one of the places where people are most likely to have some kind of skin in the game. The patrons paying money, they're choosing to come. The artists, to some extent, they need that. If, they need that opportunity for their career. One of the places that I saw probably some of my most exciting work this last year was with Whippoorwill Art. This was a checklist for artists to have a conversation with the venue. And they say, before we come there, can you be clear about where the stage is located, whether we have to do signings, face to face, whether there's going to be cleaning protocols, all of that stuff that gave the artist at that point of booking some leverage to sort of set the table a little bit more for their own safety. And I think those people on stage are pretty likely to be fairly diverse, or from a background that's probably most likely to be needing some of that support. So I think that there's power in numbers, and that those organizations that work with artists are, important. And then that coordination helps them have more kind of power to not get pushed off in the planning for those artists. Just tag in the chat, there's some indoor event recommendations. I'm going to put in the reopening guidebook, which I think is probably a good place to look for recommendations for indoor events. That was pretty state of the art. Anything else on that privilege thing? I don't want to zoom past that.
Well, I think that in general, when we are planning events, there's a lot of considerations that come up and a lot of whatabouts and what ifs. I think that a lot of times, because of the time constraints, it's easy to overlook something that is like really critical for a certain part of your audience. And so it's really important to start your planning with intentionality, so that things don't fall through the cracks that can be really detrimental, not just to specific individuals, but the sustainable success of your event. I think one of the hard parts for me in doing that is how much information is out there, but also how difficult it can be to parse what information is the information that you need and how you can apply it, especially because science and research is developing so quickly. Amelia, more so on the science side, and Matt, more so on the interpretation side. How can event planners of large gatherings keep up to date with the latest updates on COVID-19 testing, vaccines, and related information? And how can they understand how these updates impact the safety of their events?
Probably the best place to really learn and keep up to date with what's going on. I always say the World Health Organization is probably the first place I would go, just as kind of the international world public health body, especially a lot of different guidance in particular for just different groups of people for consideration of public health measures. There may be things that I'm going to miss, right, as in my current role where I work as a contractor. But there are people who can be tasked and are tasked with kind of helping to make that information really relevant to targeted audiences of people. So for instance, as I was kind of pulling to create this worksheet, I did review quite a number of different key kind of recommendation resources provided by the WHO, just about like how to, safely plan a mass gathering. Like, what are considerations that you should take into account when you're thinking about, for instance, if this is a religious gathering versus if this is another type of social gathering. So I would say that is probably the best place to go. The People's CDC is also a really good place if you're just really in general trying to just understand more about COVID, and like just if you're wanting to get more into like the grains about infectivity and things like that. They're a really good resource for just kind of learning more about like the specific virus as well. So
Event Safety Alliance is going to be spending a good amount of time on putting it into these guidelines and offering pretty clear handbooks on how to do your checklists, how to train your staff. They've got medical consultants working with them to help calibrate that. I think that it's going to give you a pretty good view there. There's some things that get missed by any organization, and I think that the things Amelia laid out give you a good opportunity to plan for your own event more in tune with your community. So it was nice to take an opportunity here to think about COVID in particular. And I don't want to say that it's fire drill for other bigger things. It's its own thing. It's real. It affects everybody in a different way, different communities differently. The type of economic impact of this are probably, a bit in the mix, I think, for a lot of us thinking about who's winning and losing when we do these events, either economically or health wise. Rubber hits the road in a pretty big way, I think, for this, because people are already living pretty on the margins who are artists. And so for them not to be able to have this opportunity is an interesting equity. It gets pretty real pretty fast. Matthew had mentioned something earlier about a reopening guidebook I see in the chat. What organization is it from? There, Bertrand's throwing it out. That was a culmination between NEVA, the National Independent Venue Association, Event Safety Alliance. We helped on that, Performing Arts Readiness. The idea that these venues can be a part of a network to do community-based resilience and preparedness work, I think is real exciting. I think that that's where I get most excited, is like, how do we use these venues as community resilience hubs, and so that they're more locally tuned. There's only so much FEMA to go around, and so these locally based networks are so important.
Given the specific challenges of COVID-19, what strategies over the past few years have you seen event planners implement to make spaces more accessible to high-risk individuals, especially for indoor events?
I'd say one of the most important refinings of our understanding has been the effectiveness of different sorts of masks, and how much more effective it is for an individual who's wearing a KN95 over bare skin versus kind of what we saw early on with pieces of cloth over beards and all of that stuff. And so the conversation about whether everybody's masks or not, that I think is an interesting one. But I think for individuals, I think arriving at, had we known that very early on, of like, if you're at a high risk, KN95 over bare skin is going to be, plus everybody else wearing masks is going to help. But I think that was one that sure took a while for us to get savvy about. And the supply chain. Yeah.
right. And there was a whole other context of background noise with that as well. And so that certainly didn't help. I would say we're all familiar with the hybrid model of having both an in-person and a virtual option. I mean, that's the most key salient one that I've seen for sure. Looking at just different ways to basically how Matthew talked about, with being able to kind of travel to artist's house and like having them really kind of document and showcase like their skill or their talent, whatever is happening, and then having that become sort of like the centerpiece of your event, so to speak, I think is pretty innovative. But yeah, I think there's just been, outside, having outdoor venues, being able to hold events outside, I think obviously we're pretty salient as well. And so I think we're trying to get more and more creative about how to have more events that could be in like less risk areas, or pose less risk for just different chains of transmission for any kinds of things. It's been a kind of a trial by error sort of process. So
yeah, that's definitely what I've been seeing. None of us are virologists, and there's always the human element that we have to consider. I think some of the best strategies that I've seen have really centered around providing enough information for people to be able to also assess their own risk personally. I remember this year's Folk Alliance conference sent a specific email out about COVID and specifically said in the presenting spaces and in the exhibition spaces, we tested the ventilation and it has this specific measurement. And so we won't be requiring masks here, but in the smaller, tighter spaces, we are requiring masks. So that allows people to know, A, people probably won't be all in masks in these places, and allow them to make their own decisions about what was safe for them, but also know that they need masks in certain spaces. And so I think a lot of it, obviously, I'm going to say community engagement. A lot of it goes back to community engagement and understanding what people need to know and what people are going to ask you so that you can have the answers for them. And speaking of masks, testing, masking, and vaccine-based mitigation strategies have really evolved over the course of the pandemic. And what are some of the latest recommendations for event organizers regarding COVID-19 and testing before, during, or after large-scale events?
I'll leave some of that to Amelia. I'm not sure if she's tracking, totally what the event production guidelines are. I guess there's kind of radio silence on it right now, I think, from what I see. It could be that I'm not on the right mailing list to hear anything that's new about that. I think it's kind of a whistling past the graveyard. Good luck, go for it. This is not a virologist talking, but I can tell you that I know a lot of people who are like 2 or 3 days into symptoms before those PCR tests are going off and showing an infection. So their usefulness to me seems like very low. I think we know too about the temperature testing being pretty much of no use. I'm not sure that relying on much of those things these days is going to do anything but maybe lead you into more trouble than it avoids.
Yeah, and that's a complete 1000% absolutely obvious critique. The testing apparatuses that we have to detect the viruses, it's not the most effective and it's not the most efficient, unfortunately. That's a whole other conversation in and of itself, just in terms of how fast does this virus rapidly mutate? And then are we able to, develop testing that is able to detect it? And it's very much a very complex thing. So knowing that trying to rely on a test only strategy is not the most effective. And again, it kind of plays back into that Swiss cheese model of testing may be a thing, yes, but also at the time of the event, what can you do? And so we know that really truly increasing ventilation, kind of like Bertrand talked about earlier, being able to test and see how good is the circulation of this particular area. Because we know that the more better circulated an area is, the more likely the air is being exchanged over. So that means that there's probably less virus in the air. And so being able to work with venues to kind of learn and understand what their ventilation capacity is really important. Being able to boost that ventilation capacity. So, being able to bring in HEPA air filters, being able to open windows, like the different things that we were talking about kind of early on when the pandemic kind of started, of being able, again, to hold things outside where there's just a lot of air being able to pass through an area. And again, also another layer being that being able to require masks is ideal. It may not happen in practice, but it is the most ideal, and in particular, requiring high quality masks. And so that is something that we have seen where there has been kind of the political storm that happened with politicization of masks earlier on in the pandemic. I definitely, from my own personal public health opinion, would certainly say I don't think help in terms of trying to get people to adopt that behavior, which it is an important behavior. Being able to, again, kind of keep stacking these mitigation measures really is kind of one of the best things that you can do. It's not one thing in isolation. You can't necessarily just rely on vaccines because we know that's imperfect, because we know that vaccines don't prevent transmission. We can't just rely, like Matthew very aptly pointed out, on testing, because PCR testing is slow. It takes 2 to 3 days. The rapid antigen tests, they can work, but there's consideration for when you're symptomatic and how long that can take before it actually shows a particular result on a test or not. And so it really does, when it comes time to an event, I think the best things that you can do are to create a space where people are exchanging air as little as possible, unfortunately. And so that's kind of just the mechanics of it. Now, what that looks like in practice, obviously, we have to get creative with when we think about again, the communities that we're serving, the audiences that we're serving, and what are the stipulations and things that you have to look out for that make event planning what it is.
Thank you so much. I think that we all know that practically speaking, there are going to be people who may not agree with one measure or the other. A lot of times, those incidents can happen that can make those holes in your Swiss cheese. So you can't depend on any one specific measure. You also mentioned hybrid events earlier, and someone in the audience says a challenge of hybrid events is that people who have the most vulnerable health needs also theoretically would benefit greatly from in-person connectedness versus isolation and loneliness, which is true for all ages. Also, older adults who have a higher risk may be less tech savvy to access online platforms. I have definitely found that to be the case for, in my experience, holding hybrid events, its own separate event platform. And to make it truly accessible, even just on the basic people can hear what you're saying level, you have to really take those considerations into mind and understand who your population is. Matt, we've had conversations about hybrid events, multiple conversations. How have you overcome some of the challenges that come with hybrid events?
Finding some partners who are able to help provide some of those wraparound, accessibility features to add an interpreter. They're not always cheap. It's not always to have the time to make sure you're inviting everybody to those virtual events. It takes effort and time to make sure you have a diverse audience. And so that can be helped by having a community partner who's underwriting the accessibility and diversity side of things, or just in your own budget. Your budget is a reflection of your values. And so if you're not budgeting for accessibility, if you're not budgeting for safety, then it's not going to just magically happen. And I suppose community engagement is kind of the lifeblood of a lot of where this is at. And I think most people on this call are interested in making beloved community events. You're not probably AEG on this call. We're probably, performing arts organizations. We want to see that cosmopolitan canopy starting to happen where people are wearing that mask when they come because they want to see it. They want to see kids there. They want to see people who are older there. They want to see people with health concerns, safe. And so that's the way to get people to wear masks or to not come when they're cold. When you're on an airplane, there's this transactional thing going on where you're like, I need to get where I'm going. I'm paying you money. It's sort of like there's a lot of entitlement that goes into some of those spaces. And there are concerts that have a very similar feeling of like, I paid my ticket. I get what I want. I want to consume this entertainment. I would say whatever you can do to create a beloved environment is probably going to contribute to health and satisfaction overall. Yeah, your budget is a reflection of your values. And so taking time to plan, like you said, Bert, for that's going to reflect your values too. And then on the big part of our country, this Build Back Better stuff, we're going to be spending more money on this recovery. The Inflation Reduction Act and all of these things are supposed to be helping us make infrastructure that's more healthy and sustainable for everybody. And when it comes to those filtration systems and so on, with all the wildfires, the smoke that came down from Canada into New York City, and you're going to live longer if you're in a venue or a home that has good filtration. Fresh air is only good if the air outside is clean, and that isn't always going to be the case. And so, those MERV 13, MERV 14 filters that can get down to that size, that's something that everybody should have in their house or their apartment, and that's an equity issue. And if Build Back Better funds are just building highways for more cars instead of, these sort of things for our families and our venues and things, then that's a bummer.
And on an advocacy point, a lot of that money is being allocated by states and municipalities and counties, right? And so how that money gets spent is something that you can advocate to your local government about. We are approaching 2:15, the beginning of the Q&A section. So I'm going to ask one more question. And then if anyone has any questions they want us to wrap up with, please put them in either the chat or the Q&A section, and I will queue them up. One thing that we were talking about in our pre-meeting was that different groups of people have a different tolerance for certain mitigation strategies. Some people are very against vaccines, and some people do not like masks for a variety of reasons. And a lot of that's cultural or religious or individual, but they're people and they're there. While it's important to have these approaches in place, how do you take that human element into account?
This is one of those like enduring questions. That's the exciting stuff, right? When you get into things where it's like, we got a whole lifetime to work on this thing. It's like becoming better at hearing where people are coming from and trying to sort through the noise, like Amelia said, of like what's somebody's position because they have an informed place or they're just kind of getting emotional about something. There's a technical way to do that. I think you talked about this, Bert, when we did a prep for this meeting. When you worked in the Army, you were talking about you do situational awareness of what the environment that you're going into is. Is it friendly, confrontational, cooperative, and sort of that checklist can be something you do formally, or as you get older, or maybe you're born smarter and you just kind of know like, here's where I'm going into. I guess establishing a baseline that everybody's relationship has integrity and clarity to it is helpful. Flowers and bees, there's a relationship where everybody knows what they're in there for, what they're getting out of it. It may be different. And I guess going back to that thing we were talking about with what's the relationship of the artists on the stage? Are they kind of coming hungry and needing that money? And then is the venue taking advantage of those artists, to kind of provide something like just that transparency of those interactions and taking time to sort through what everybody's getting out of the relationship and trying to figure out more win-wins is important. And if we're not gaslighting each other about that sort of stuff, it's a good place to start recognizing violence and oppression that it kind of has been present in a space before you plop down your art is important, right? Context is really important. If we're trying to avoid violence or harm, those are things that have to be acknowledged before you try to just plop down your ticketed event or something. Yeah, I'm just sort of in it for a lifetime to sort through how to do that better because that's the important stuff.
That's a lesson we got in Boston when we spoke to some stellar event planners. I asked them, like, what do event planners in Boston need to know to be successful? And they said, you have to understand the community that you're hosting your event in, because Boston can seem like an unfriendly place, but really you have to build those relationships with people. And once those relationships are built, Bostonians can be some of the most generous people. You can't do it alone. They
But they
said,
told us just because one neighborhood.
exactly. And they said you can always attract out of towners. You can always attract the yuppies who are coming into the city for what they want to see. But if you want people from that community to patronize your events, you have to be in tune with what they want and what they need. Amelia, from a public health perspective, I know that y'all have probably collectively been wanting to pull your hair out with how people have responded to different public health advisories. How has the public health evolved in trying to deal with that human element?
I think the reality of it has been largely, I think, getting people to sort of do their own risk assessment, so to speak. What is my own personal risk, really, of just getting infected, right? It is an imperfect strategy, like nothing is perfect. And so, because with the way that public health kind of has like standards or guidelines that may or may not be attainable, as we talk about kind of equitably in a community, oftentimes requires really intense, I think, community engagement in order to really temper what is this ideal that we're looking for in order to preserve the public's health versus what is the practicality of what actually happens. We all live in an interconnected world, and this illness is unfortunately a fact of life. And so, how do you balance that need for safety versus the reality that everything is kind of imperfect? We don't exist in a vacuum that we can perfectly manipulate in order to keep ourselves from getting sick, right? It's something that public health kind of, I think, still needs to learn a lot more of, honestly. Don't get me wrong. We understand as a field that, like a lot of times you may have an intervention, which is a program that you may bring into a community that you want to, let's say, it has something to do with like maybe cardiovascular health, and you want to try to decrease people's risk of cardiovascular health with getting them to enroll in like a lifestyle change intervention, essentially. Really being able to, again, know that community and tailor and ensure that it kind of culturally humble is important. And I think that's something that is hard to do in an emergent situation like COVID-19, right? When the wheels hit the ground, there are some people who feel more of a bump than others do, obviously. And we know that there are differing disparate outcomes for different groups. And so it is something that definitely the field has had to contend with. It has been imperfect. I think we're still contending with it, unfortunately. I think it's going to take really intentional engagement in order to really learn more about how we can better get people to adopt behaviors that are given to a favorable outcome for their health. That is a long way of saying that, we haven't had necessarily a solution to this, right? And I think, again, Matthew kind of alluded to it. It's a lifelong question, and we're just learning more about it. But it seems that the wisdom, it really is being able to kind of like work with groups that intend to be excluded as well.
Thank you so much. One thing that Matt says to me all the time, courtesy of his mother, is that an important aspect of learning is enduring questions. Definitely how you balance what your community will or tolerate and what is the best objectively approach is going to be one of those enduring questions for event planners, I think, for forever. I love that culturally humble concept. The last thing I wanted to talk about from a community engaged perspective, always have noticed, but sometimes it's hard to talk about, is how many people get excluded from our events because of these mitigation efforts. I was producing, it was a Black classical music festival, and we were in a hotel for an entire week. And the staff was super helpful. They made like 230 copies of something for me. And so I really wanted to thank them by giving them a ticket to our show. But the show required that you be vaccinated to attend. I didn't even think to ask if they were vaccinated. And unfortunately, they couldn't go. In terms of safety of that event, that is sort of the ideal outcome. But in terms of the other goals of that event, it's something that you lose. Really going back to that balancing act and decisions that event makers have to make. Matt, how do you grapple with that?
You learn as you go. And an expert is somebody who's messed up everything possible in a narrow field once and remembered what they did wrong. No, I don't know if that's really true, but it's funny. Yeah, similar experience to yours. We had an event where one of the really important speakers said that she hadn't done a vaccination, wasn't going to do a vaccination, wanted to know if she was still able to present. And we were able to do a test at that time. But, look, it was very early on, and we sort of thought we were in an audience of everybody who was, going to do that. One of the people who wasn't able to do it was an important person in that event. There weren't old white conservative or something like vaccine skepticism can kind of come from a lot of different reasons. And part of that can be a distrust of the American medical system for reasons that are pretty historically reasonable. So enduring question, another one I'll throw out. Sorry if this isn't answering everything, but reasons of bodily autonomy come into this interesting full circle. If one group might say, hey, bodily autonomy means a right to choose, but that same group might sort of say, we think vaccine mandates are a good idea, right? What is all that? How do we all sort that out? And people being able to make a living, whether or not they get a vaccine, was a pretty important question that came up during this time. And I think there's a lot of uncombusted feelings about climate change and science around there that fueled where we were at with this. I brought up that the immune system of our own bodies can sometimes have an autoimmune response that is sort of hyper vigilant and creates health problems for us. And our larger cultural immune systems can sometimes hyper respond to things in a way that might kind of seem analogous to an overreaction of an immune system of our cultural or our health systems or our sort of those things. So I don't know. I'm still sorting some of those things out as we go through this. And so I'm thankful that we had a chance to talk today, and sorry to leave it with some of those larger questions, but I think this is a good group to do it with in the future. And I stand ready to hang on other conversations in the future. Thanks again for inviting me.
Thank you, Matt. Amelia, we only have a minute left, but did you have anything you want to add to that?
I echo a lot of what Matt said, that it still requires this balance between the individual's need, and this is also the perennial question of public health as well, and public health law and potential. In particular, it's kind of the individual's need versus the kind of greater collective need, right? I think that largely will be dependent on the groups of people that are being served in that space. Like, what do they overall value? And that can, I think, differ based off the group that you're in. That can differ within groups that you have. It's a very complex issue, and it's going to be one that is, you have to kind of learn as you go, I think, again, as well.
Great. Thank you so much. And with that, we're going to wrap up. Thank you, Matthew and Amelia, for participating. Huge thank you to Performing Arts Readiness for sponsoring this webinar and helping us really unpack and untangle some of the large fire hose that is information about COVID. If you are interested in seeing a recording of this, we will be hosting that on the Performing Arts Readiness page. Once that link is available, I will send that out. Please don't forget to download the risk management worksheet that Amelia made for us. Additionally, I will be saving the chat and gathering all of the resources that people shared and putting that into a resource sheet that will be in that same folder that the worksheet is in. Thank you so much for your time, and I look forward to our next conversation. Have a good one.
Have a good one.
Thanks,
Bye.
Bert.